I've had a dental practice for 10 years. Do I need a PIA? Well, in Alberta, the Health Information Act was proclaimed in 2001. Dentists and dental hygienists were named as designated health professionals under the HIA in March 2011. Custodians, including physicians, chiropractors, dentists, and dental hygienists, as defined by Alberta's Health Information Act, must follow the HIA regarding the requirements. Now, there is a requirement about doing a privacy impact assessment, and the privacy impact assessment needs to be completed whenever there is a new practice that's opening or a change to the practice. So let's take a look about what this means. Now, first of all, just a reminder that who is a custodian is defined by the Alberta Health Information Act. Firstly, you must be a member of a regulated health profession, and that health profession must be named in the HIA as a custodian. And then that individual needs to be acting as a custodian in their practice. Now, we have many custodians that have been named under the Health Information Act. The dentists and dental hygienists were named in March 2011. So the dentists are required to complete the privacy impact assessment if they are opening a new practice or if there's been any change in their practice. If you had a dental practice that was in operation at the time that you were included as a custodian under the Health Information Act, the requirement for the PIA was grandfathered. So you still had to have good policies and procedures in place, and those are college requirements before you were identified as a custodian under the Act. But the requirement for doing a PIA was grandfathered. That means that you did not have to do a PIA immediately in 2011, but now if you've had any changes, that will trigger a requirement to do a privacy impact assessment. So the question is, have you had any changes? In the last 7 years, since 2011, have you had any changes to your administrative practices? For example, how you do your billing systems or vendors that you've been using to do billing. Have you made any changes to the information system or computer system? Practices relating to the collection, use, and disclosure of personal health information. New information flows. Perhaps you've started a new project, you've included new stakeholders in your practice, you're sharing information with another dental clinic or service, or perhaps now you want to have access to Netcare. Have there been any changes to the legislation that are applicable to you? Now, there were some changes, for example, in the legislation under research. So if you're doing clinical research in your practice, then there are requirements to do a privacy impact assessment for those purposes. Are there any new risks to the privacy of health information that you've had to accommodate? So, for example, we've had a lot of concern about cybersecurity. So perhaps you've implemented some additional protection and security in your computer systems to prevent that. Now, that may require a privacy impact assessment as well. If there's been any changes to the custodians in your practice, so you've had additional dentists or dental hygienists joining your practice or leaving your practice, these are all things that will trigger doing a privacy impact assessment. So if any of these things apply to you, then you need to do a privacy impact assessment.